Hi, my name is Savannah Peters. I'm going to present a patient that I saw in my dermatology rotation. So this is a young 26-year-old woman presented on May 14th, 2025. Her chief complaint was an itchy red rash that appeared on the right side of her nose, right side of her cheek, and around her mouth about a week and a half ago. She stated that she tried Vaseline to help with the dryness that she was experiencing, but noticed an oozing and a honey-colored crust forming. So she stopped all those interventions, she made an appointment, and came and saw us. So subjectively, all of her systems are intact. The only one that is not is the skin because of that facial rash that she has been experiencing. She denies any lesions or any changes in or new moles. Mental health wise, she states that she has been feeling self-conscious about this rash and wants to figure out what is going on so it can go away. Objectively, this patient's vital signs are stable. She is 5 feet 4 inches and 140 pounds. Her general appearance, she's well groomed. She's alert and oriented and very cooperative and well developed. Skin-wise, as a provider, I noticed the rash on her face, specifically on the right side of her nose, right cheek, and around the mouth. The rash is red, it's crusted over with a honey-colored tint to it, and at today's visit, there was no active oozing noted. All other body systems are intact objectively. Moving on to her assessment, so her problem list includes an itchy red rash that appeared on the right side of her nose, right side of her cheek, and around her mouth about a week and a half ago. The rash has oozed and is now crusted over with a honey-colored crust. Her differential diagnosis list. So once I heard honey-colored crust, I immediately thought impetigo. This is due to the placement of the rash, the itchiness, the oozing, and like I said, the honey-colored crusting, because that is very characteristic of impetigo. Second differential diagnosis was eczema. She experienced the itching, the redness, but the oozing and honey-colored crust made it more characteristic of impetigo. My third option was shingles, but shingles usually follows a specific nerve pathway and consists of blisters that are painful. And then my last differential diagnosis was herpes simplex or cold sores. This is the least likely diagnosis because of the presentation of the rash. The rash is around the nose, cheek, and mouth. It's not directly on the lips, and it doesn't include any painful blisters like cold sore usually does. So I am diagnosing this patient with impetigo due to the presentation, specifically that honey-colored crust. So the plan for this patient, unfortunately, there's no specific diagnostic testing for impetigo. It's usually diagnosed by the presentation of the rash. If prescribed treatment does not work, a swab and culture can be done to assess what specific bacteria is causing this rash. As for treatment, the patient should be prescribed Mupirocin 2% ointment to be applied twice daily on the affected area for 5 to 10 days until the rash is gone. The patient was educated to keep that area clean and dry, avoid scratching the rash, and use a warm compress to remove the crust before applying that ointment. Instructed the patient to remain cautious for the first 72 hours and not spread the rash to anyone else. And how to avoid that is to avoid touching it and then touching someone else. And then if she lives with anyone, a partner, a roommate, something like that, that she should not share any pillowcases, towels. So be very careful with that and wash everything. For the follow-up visit, there's no follow-up visit that needs to happen as long as the rash resolves within that treatment window of 7 to 10 days. I definitely would instruct the patient, though, that if the rash persists after treatment is complete, that a follow-up visit should be scheduled. We want to make sure nothing else is going on, or if she needs a different treatment plan, or if we need to swab for a specific bacteria, we can do so at that time. But otherwise, that was a very interesting presentation that I saw, and yeah, have a good day.